is we are going to dioceses, where we are going to not only engage medical practitioners, but also pastoral agents, like pastors and other faith leaders, just like we did in Nairobi, also to share this knowledge and to give them an opportunity to listen to scientists. And so far, we're using different same models in Africa. So far, we've done things like that here and in Zambia. I remember where we brought pastoral agents, pastors, and what we call deans. That means priests who are in charge of various regions and share this information together with health practitioners. And also, like Brenda mentioned, the HPV vaccine is available. So we also bring UNICEF, we bring other actors on board so that these things are done on the ground. Yeah. So and we won't tire. We won't tire. We will keep bringing this voice out. And especially, like I said, the pastoral agents in the parishes will be speaking about this to our people in the local areas. Not just to convince them, like Brenda mentioned, to fill them with knowledge so that nobody dies from ignorance. So we are moving in a very practical way. Thank you very much.
Respond to the two questions that have been asked. One is on policies that we are asking for promotion, and the second one is on HPV vaccination and the fear in the community. Starting with the policies, the government of Kenya has invested quite a lump sum in bringing the vaccine free of charge to girls ages 10 to 14, and also making available services for screening in all public health facilities. So any woman who would walk in and request for screening, they will get that service in government hospitals. And for girls, it is free of charge. No girl should be charged for the vaccine. We have also policy documents that have been done, including the cervical cancer elimination strategy by the WHO, which is focused on getting 90% of girls all vaccinated, 70% of all women screened, and 90% of all women found to have anything suspicious or advanced disease treated. And that is what is called the 90-70-90 elimination strategy. Now, the sad bit is that we have these investments, and Kenya is leading amongst African countries in bringing these services. But people are not aware about this. And that is why we need you all, as faith leaders, as well as people in the media fraternity, to be able to take this message to the community. That services are available, investments have been done, policies are there to guide service delivery, and the government is investing in healthcare systems. What will happen is, if we have more uptake of these services than is already readily available, we as civil society organizations that sit on various technical working groups, then we'll go back to government to say the service is not enough because people are taking up the services. But right now, going back to government to say, bring us the services, and they're already there, and they're not being taken up by the community, is really a waste of resources. So let's get our women informed. Let's get men to support the cause of action. Let's get faith leaders to utilize their opportunities in the pulpit, in their places of worship, to talk about these services. Let me speak briefly about safety.
If it is safe for humanity and it's promoting life, the church, especially, and all of us in faith-based, we are always at the front line. But any vaccine or any drug or any initiative that comes to harm human life and human dignity, the church does not support. And we will always stand with that, because we stand with the values of what Jesus taught us, that human life is precious, human life is godly, is divine, and we cannot destroy life, we can only promote life. Thank you.
A long time ago with HPV vaccination. She's in this room. She already has her story to tell of the safety and all the things that have been myths that have been propagated. The only thing is that I go back to what the good book tells us. Our people suffer for lack of knowledge. If one person tells a lie and runs around telling the lie, it is more believable than when many people are telling the truth. And the truth is, the vaccine is safe, it is available, it has been proven to work in over 100 countries, and over 80 million doses have been given already in the world, and therefore we see women as being safe when they receive this vaccine for prevention.
Sister Esther, they'll be able to go deeper and explain everything to us. So we are going for a tea break. We will use